Hello, everyone. Today we are going to discuss the approach to a pediatric station. Now, the approach to a pediatric station is going to be a bit different from the rest of the stations, as the differentials and some parts of the history are going to be very different from the rest. So, let's discuss the history and but the good news is that all the stations, there's going to be nothing different. That's going to be the same questions, the same history that you have to take in each and every station that you come across. So there's no difference. Once you are able to memorize these questions that you have to ask, you can tackle any pediatric station that you come across. So let's get into it. First of all, you need to, as you do in all the other scenarios, first of all, you need to introduce yourself and ask for the patient's introduction. Now, while you're starting with it, you have to keep in mind that you're talking to the patient's mother or father. You're talking to a parent. So keep in mind that you're very empathetic, you're very polite, and you're very understanding, and you put in a lot of effort in reassuring the patient's attendant who is the parent. So you have to keep that in your mind while you're working on it. Then, once you're done with your introduction, now you have to move on to the history of presenting complaint. Now, history of presenting complaint can again be divided into two things. If if it's some kind of pain, then you have to follow Socrates, and if it's any other symptom, then you have to follow Odipara. The details of these, you can go ahead and watch our video on history taking to get an idea of how you are supposed to ask each of them. Then moving on, now we come down to our systemic inquiry. Now, systemic inquiry is basically the differentials that you will be keeping in mind when you're approaching a pediatric station. So, the first one that you may ask about is meningitis. So, for that, ask about any temperature, ask about any rashes on the body. Then, coming down to ears, ask about otitis media. Does she have any discharge from her ear? Does your child pull his or her ear when crying? Moving on, ask about tonsillitis or any upper respiratory tract infection. So, is your child able to eat or drink properly? Does he or she feel pain when they're swallowing? And in an upper respiratory tract infection, ask about sneezing and ask about runny nose and ask about cough. Then, if we come down to cough, ask about any shortness of breath along with the cough and any kind of chest pain so that you're able to rule out pneumonia. Then move on to the gastrointestinal tract. When asking questions regarding gastrointestinal tract, you can ask the very basics. So, is your child having any diarrhea, any constipation, or any vomiting? Then, lastly, ask about UTI. The questions that you may ask regarding that would be: does your child cry when passing urine, or he or she wet her nappies when more frequently than before? Now, once we're done with the differentials, now we are going to follow a mnemonic, which is bird and DDD. Okay, so just memorize this mnemonic. It will make it much easier for you to ask questions in a certain order and make sure that you're able to complete all the history questions that you have to ask. So, B stands for birth history. Now, questions that you have to ask regarding birth history would be: have you had any problems with your pregnancy? How many weeks was your pregnancy? Have you had any problems during delivery? Was it a normal delivery or was it a C-section? Did the baby cry right after the delivery, and did he or she need any special care after the delivery? Moving on, ask about immunization. So, is your child up to date with the vaccinations? Then ask about the red book. Are you happy with the red book? Then ask about the child's development. So, just one simple question would do it. Are you satisfied with your child's development when comparing your child's development with other children around? Then ask about the child's diet. What do you feed your child? Have you made any changes to the diet? Is he or she breastfeeding? Is your child gaining weight? And what do you feed your child in breakfast, lunch, and dinner? Then ask about dehydration to assess any chances of dehydration. So, in cases of mild dehydration, the child may have a dry mouth. The child may be crying without tears and not wetting his nappies as often. In cases of severe dehydration, the child might be drowsy or might be sleeping a lot or could be lethargic. So, ask your questions regarding that as well, and you should be able to differentiate between mild and severe dehydration. Then, lastly, you need to ask about non accidental injuries, or you have to ask about any cases of um, deliberate a deliberate hurt harm to the child. So ask your questions like, do you have any social worker involved, or who do you live with, and who else lives with your child, and who does take care of your child when you're not around. Then once you're done with your history, that's all for history. That is all you need to ask. um Ask the mother, how does she feel. So for parents, when it comes down to their children, it's going to be a bit difficult for them to deal with that situation. So it's something that they're very sensitive about. So you have to ask the mother how he or how she is coping with the situation at hand. So that would definitely give a good score in your IPS if you're doing that. Then moving on, now you need to do the examination. And with the examination, you're doing your observations as well. So explain that I will be doing the observations, in which I will be checking your child's blood pressure, temperature, respiratory rate, and pulse rate. And along with that, I will be examining your child from head to toe, which means that in this, you will be doing a general physical examination. And along with that, mention the specialized examination in relation to the presenting complaint that the patient comes to. So that's about it. That is all that you need to follow, and these are the basics of the approach of pediatric history. We try to make sure that the videos are concise and the videos are as to the point as possible, to make sure that you're able to learn in less amount of time, and you know the basics that you need to know in order to clear a station. So thank you so much for watching, and if you have any questions, you can comment down below. And other than that, if you want to take up any courses, any practice tests, or if you want to do any mocks, then you can email us at plabquest1@gmail.com. Thank you so much.